Hi, I'm Julie Ray, and I'm the Operations Manager for the Baby Haven Child Care Center. First, I would like to thank you all for being here today. And secondly, I'd like to tell you a little bit about the Baby Haven Child Care. We primarily serve children with risk factors, including coming from families with a history of substance addiction, co-occurring mental health, poverty, incarceration of a parent, domestic violence, and prenatal exposure to drugs and/or alcohol. We're licensed, we're a Colorado Shines Level 5 provider and one of the highest quality providers within the state of Colorado. While we serve children from birth through 5, we primarily serve infants and toddlers. And our goal at the Baby Haven is really to be able to support families in their childcare needs from birth all the way through to kindergarten. Of course, this year has presented all of us with many challenges, and we were closed during the stay-at-home order period from March 16th through May 31st. We reopened on June 1st with a comprehensive health and safety plan in place, and we are happy to report that our children are doing well and happy to be back. But during the closure, we immediately knew that our families were going to need us more than ever. So we ensured that families got weekly calls to check in and see how they were doing. And when we had concerns about families' mental health, we were sure to be able to connect them to online free mental health services through our partnership with Mental Health Center of Denver. And now we also see that our kids are giving us so many hugs, and parents are so grateful to have us reopened and back, and our legs are getting lots and lots of social distancing hugs, which we just love so much. We're also happy to share that children are able to receive on-site complimentary dental, vision, and hearing screenings, which is tremendous, so parents don't have to take time off of work or be out of treatment in order to meet their children's basic needs. 90% of our Baby Haven children are meeting or exceeding their developmental and growth goals per national standards. And this is tremendous considering the many challenges that these families and that these children face. So ample research shows us that from a bottom line perspective, it costs less to invest in treatment and early childhood education than it does to build and support prisons and to foster continued dependence on social systems. So the two-generation approach that's employed by the Haven and the Baby Haven truly puts the whole family on track to be successful, and it directly benefits the bottom line, it directly benefits families and the community. So if you're asking yourself today, can my donation make a difference? The answer is a resounding yes, absolutely it does. Because without you, without the Friends of the Haven, the Baby Haven, and the Haven, there are very few other places for these families to go. So your donation ensures the most vulnerable children have access to a place where families can learn how to turn their lives around and become safe, sober, and successful. Thank you so much for being here today.